Okay, today we're going to deal with 5 chapters, right? And these are chapters dealing with what? The immune disorders. What's the other one? Malignant disorders of white blood cells. And then what? Hemostasis and blood coagulation disorders. At the same time, we'll deal with what? Blood flow and oxygen transport. Okay, let's deal first with oxygen transport. We know for a fact that in the body we have what? The heart, right? What does the heart do? It pumps blood. And the blood contains what? Oxygen to be pumped to every single part of the body, right? Now the question is, which one will carry the oxygenated blood? Which blood vessel? The arteries. That's the reason why they're red. What about the veins? What kind of blood do they carry? The oxygenated blood, right? So if it's blue, it has to be what? Venous blood. Blood rich in carbon dioxide. Well, if it's red, it's blood rich in what? It's arterial blood. Blood that is rich in oxygen. Regardless of whether it is an artery or vein, what is the cell that transports both oxygen and carbon dioxide? What cell? Of course, the red blood cell, right? The red blood cell is also known as what? Erythrocyte. The red blood cell is produced where? Which one?
Red.
That's the reason why it's called red bone marrow, right? Produced where? Red bone marrow. Site of production. And we know that the red blood cell will die in how many days? 120 days. That's approximately 4 months. Question now is, where do they die? Spleen. Liver is the secondary choice. But the number one choice is what? The spleen. So on the 190th day, as they travel to the spleen and they're about to die, they'll be going like this. And GPS, tell me where is the spleen? Oh, over there on the left upper quadrant. OMG, I'm about to die. When he reaches the spleen, guess what happens? He dies. Why is there a need for them to die in the spleen? What happens in the spleen?
Recycle iron.
What?
Recycle.
Very good. How do you know about recycling of iron?
I watched the video.
You did watch the video. Very good. So here in the spleen, the key word is to recycle, because the dead red blood cell can still be useful to the human body. In what way? It has the iron. And is iron needed to produce the red blood cell?
Yes.
Definitely, right? Iron. And where do you think this iron will be brought to? Of course, the red bone marrow, where it will produce the red blood cell. Isn't it amazing? It all makes sense. The birthplace of the red blood cell is the red bone marrow. The death place, is there such a thing as death place?
Retirement home, Florida.
Forest Lawn Cemetery. The red blood cell will die and be buried in the spleen cemetery. And guess what? Because the human body is so amazing, it will recycle. Recycling, and it's good for you. And what happens now is that this iron is brought back via what? The blood vessels. To where? The red bone marrow, where they were born. So that they can now be used to produce more what? To more red blood cells to replace those cells who died. Isn't it amazing, the story of the red blood cell? It's a sad story, but it's a happy story. Because the red blood cell performs a very important function in our body, which is to transport oxygen and what? Carbon dioxide. Now, what do you know about the red blood cell? What happens to the red blood cell? Upon its birth, and gradually as it gets older, what happens? Will it retain its organelles? No, it will what? The organelles will be lost, right? Okay. What else? Therefore, if you lose the organelles, what will now be the main source of energy for the red blood cell? What substance? It begins with letter G.
Glucose.
Of course, amazing. So what will be the source of energy? Glucose. Do you understand? And therefore, we realize that the cell needs glucose, and that's why it's provides the energy for the cell. It loses the mitochondria, there's all the other cells, but basically you would still have glucose there. Now the reason why it has to lose the organelles so that it will be easy for it to what? Travel within the blood as it travels to the capillaries. Remember? You remember, okay? The capillaries are the smallest blood vessels, right? And apparently, if you look closely here, if this is a capillary like this, it's only made up of squamous cells, very flat cells. It can only accommodate one red blood cell. And what is surrounding a capillary? A cell. It could be a muscle cell, brain cell, whatever cell, around the capillaries. The red blood cell is like a Krispy Kreme what? Donut. It's a biconcave disc. Remember? And how many globulin molecules does it have? Is that what you learned from anatomy?
4.
4. Very good, Tigran. How do you know? Do you remember that? Okay, 2 alpha and 2 beta chains. That's what it's called. Hemoglobin, right? How many globin molecules? 4. 2 alpha and 2 beta chains. And what is found in the middle? The porphyrin ring. Remember? And that's the porphyrin ring is the one that carries what? The iron. So is it always important to go back to your anatomy and physiology? In other words, if you have 2 alpha and 2 beta chains, then you have those what? Heme. The heme is where you find the porphyrin ring, which contains what? Iron. In other words, how many maximum oxygen can you carry therefore? 4, because there are 2 alpha plus 2 beta, you have 4. Does that make sense? Okay. Now, if this were what you call a small artery is known to be what? Arterial. What about a small vein? Venial. So who is going to transport the oxygen and CO2? The red blood cell. Just relax, chill. Okay? Who will transport the oxygen and CO2? The red blood cell. If the red blood cell is here, Krispy Kreme donut, oxygen is on the red blood cell because it's in the arterial system. So oxygen is going to be carried where? To the capillary. And the oxygen here, remember the principles of diffusion, movement of substances from an area of what? High concentration to what? So by the time this red blood cell that carries oxygen reaches the capillary in all the tissues of the body, what happens now to the oxygen? From high to low. Where will the oxygen go? To the cells that make up the tissues, whether it's brain tissue, muscle tissue, bone. Does that make sense to you guys? The muscle tissue of the brain, of the heart, myocardium, right? Now, in return, I compare the red blood cell like a red bus. Who was the passenger here in the arterial? The oxygen. Upon reaching the capillary, the union station, what did the bus do? Unload the passenger who happens to be what? Oxygen. And by the principles of diffusion, from high to low, guess what? The cell will be happy. The cell will not die but live because it now has oxygen. But what is the cell producing as waste? Carbon dioxide. Do we have a lot of carbon dioxide in the cell? Yes, we do. So what happens now to the red bus? The red bus is now empty. waiting for the next passenger. The oxygen was just unloaded by the red blood cell or the red bus. This is just an analogy, by the way. There is no bus there, right? What happens to the carbon dioxide? Again, by the principle of diffusion, from high to low. Now remember, the red blood cell does not anymore have the oxygen, who now takes over the seat of the place, carbon dioxide. So by the time the carbon dioxide goes in, excuse me, who is carried by the red blood cell? Carbon dioxide. Now you know, where does this go? All the veins, as you recall, if you remember, right atrium, right ventricle, left atrium, left ventricle, right? If you remember that when it comes to the chambers of the heart, the superior vena cava and the inferior vena cava brings all the veins where? Head, neck, and upper limbs. What about the inferior vena cava? All the veins. Where? Lower limb and anything below the heart. Thoracic, abdominal, pelvic region. And of course, the lower limbs. So all the veins in the head, the neck, and all the veins in the feet, the leg, and the thigh, they go to the inferior vena cava here, they go to the superior vena cava. Where do they go? Right atrium. There is a tricuspid valve here. Goes to the right ventricle, comes out in the pulmonary valve, goes where? To the lung. And what happens in the lung? Exchange of gases will take place, just like what took place here. Between the air sac and what? The pulmonary capillaries. Do you understand? How? By bringing it via what? The pulmonary what? Trunk, which gives rise to the pulmonary what? Arteries. Two, one on the left, one on the right. When it reaches the lung, what happens now? We get rid of the carbon dioxide because the veins contain what? Blood rich in carbon dioxide to the red blood cell. We exhale the carbon dioxide. And what do you do when we inhale? Okay, everybody inhale. Everybody exhale. So when you inhale, what do you bring in? Oxygen. And when you exhale, what do you bring out? Why are you bringing out carbon dioxide? Because it's considered what? Waste. It's considered what? Waste. Considered what? Waste. Repetition is the mother of all retention. By repeating something, hopefully you will not forget. And you will always. So you get an A in this and pass the nursing board. Or take one. And buy your 10 cars and your 10 houses, right? Okay. So in the lungs, therefore, exchange of gases will take place, and it goes back to the heart via what? Blood vessel. Pulmonary veins. From the right lung, 2. From the left lung, 2. And what happens now? They go to the left atrium, left ventricle. There is the mitral valve, then aorta, and then what? Aortic valve. Remember, the aorta brings what? So the aorta, so let's make it easier. This is the left ventricle here. The aorta goes like this, right? Left ventricle, ascending aorta, arch of the aorta, descending aorta, and then now it brings all the blood to different organs. For example, thoracic aorta pierces the diaphragm, abdominal. What do you call the artery of the kidney? Renal. Both sides. What do you call the artery of the liver? Hepatic artery. So whenever the heart pumps blood from the left ventricle, does it go to the kidney and the liver? Yes? What kind of blood? Oxygenated blood. What about the brain? Does it go to the brain? Yes? The common carotid artery, common carotid, divides into internal and external, IC and EC. The IC goes to the brain and becomes your cerebral what? Arteries. So when you palpate for the pulse in here, what do you palpate? The carotid pulse. Does that blood vessel bring blood to the brain? Yes, it does. In other words, the red blood cell is going to flow in this. Whether it's an artery or a vein, it has a role to play. Right? Do you understand glass? Does it need iron?
Yes.
Yes. Does it need hemoglobin, which is a form of protein?
Yes.
Yes. Right? Do you understand? Now, there was mention of different conditions here, right? And one of them has to do with what? Anemia, right? And it's therefore important that you know how to what? Come up with a way to organize your material. What do I mean by that? It simply means that in order to organize your information, we need to come up with a map. What's a map for? To guide you to be able to reach your what? Destination. It's called a concept map. So in other words, what I'm trying to say is that you need to come up with something that will guide you. So if I put the word anemia here, what does anemia mean? Decrease in the red blood cell count. Okay? So what would be examples of anemias that you are familiar with? Give me one. Audience participation, interaction. Yes. Iron deficiency anemia. Do you agree with her?
Yes.
Of course. Why would it be able to lead to anemia?
Because you need iron to make red blood cells.
Thank you. Why?
You need iron to make red blood cells.
Because you need what? Iron to produce the red blood cell. If there's not enough iron, guess what? You end up with less red blood cell. So it's called iron deficiency anemia. Now, is this the most common form of anemia?
Yes.
Of course. When a woman is pregnant, do we provide ferrous sulfate to our patients? What is the chemical symbol for iron? Fe. Fe. Fe is iron. So when we give ferrous sulfate, is that an iron supplement to pregnant women? Why do women develop iron deficiency when they are pregnant? Yes? Because why? You're sharing your blood with who? With the baby. It's not only you. The fetus inside your mother's womb. So what will Dr. Gamo provide the mother with? Ferrous sulfate. Guess what? What will we tell the patient, the mother? When you take ferrous sulfate, what will be the side effect on the color of the stool? It becomes black. And if you remember, I don't know if I mentioned this before, what is the normal color of the stool? Golden, yellow, brown. Gold. What it becomes black, is that normal?
No.
That means there could be possibly what? Bleeding that came from the stomach that traveled a long time for it to reach the stool, and therefore when it comes out as your poo-poo or your waste, guess what happens? It becomes black. It's called melena, M-E-L-E-N-A. M-E-L-E-N-A, guess what? Will that giving of ferrous sulfate will also resemble black tarry stool?
Yes.
But it has nothing to do with bleeding in the stomach because of a gastric ulcer, but rather that is a side effect of what? The drug called ferrous sulfate. So is it important that nurses like you who will become future nurses educate your patients, particularly the mothers who are pregnant, who was prescribed with Dr. Gamo the drug called ferrous sulfate, that you will expect this to happen, ma'am? So don't be alarmed. Unless, of course, you have a pre-existing gastric ulcer, you should be alarmed. But you always tell them, if there's a change in your stool, tell your doctor, because I have to explain to you and I have to tell you whether it's because of a bleeding ulcer or it could be the effect of the drug. Do you understand? Now, give me another one.
Aplastic anemia.
Okay, aplastic anemia. Very good. So obviously all of them have a decrease in red blood cell count. What is the most common cause of aplastic anemia?
Stem cells.
Hmm? Hmm? So the most common cause, etiology,
Chemicals, right?
exposure to chemicals. When I was a young medical student, it was very common. Remember what did we do to get rid of the pests in the garden? We used pesticide, insecticide. But during this time, in the 80s, some of these pesticides and insecticides contain certain chemicals that will damage and destroy what? The red bone marrow. So these chemicals apparently destroy the bone marrow, right? And if you recall, what does the red bone marrow produce? Red blood cell. What else? What? White blood cell, of course. And what else? No, is the platelet a cell? It is what? A fragment of a cell. The platelet is not a cell, but rather, what was the original cell? What is it called? Megakaryocyte. Perfect. What does mega mean? Big cell. So whenever you hear the word megakaryocyte, that was the original cell, and it broke down, it became fragments, it became the platelet. We used to call platelet thrombocyte. What does thrombus mean? A clot. In other words, it's not appropriate, because when you say thrombocyte, cyte means cell. It's a cell that's supposed to produce clotting. But is this a cell? We no longer use the word thrombocyte, we just use the word what? Platelet. And therefore, what is the platelet? Therefore, purpose of which is what? Blood clotting. And what is thrombocytopenia? A drop or decrease in your what? Decrease is called what? Thrombocytopenia. And guess what? If there is a decrease in the amount of platelet in your blood, will the blood clot? The patient will and could bleed to death. And what do we provide these patients with? If they lack platelet, what do we provide them with? Platelet products and platelet. Isn't it amazing? Don't you love anatomy, physiology, and pathophysiology? You and I are you're going to be working with doctors, and therefore you have to know exactly what we do. They lack platelet, what do we give them? So why will the platelet count go down? Because you have destroyed what? The bone marrow. So in other words, it is not just anemia that will be present here, but you also have what? Thrombocytopenia. Anemia is obvious, because if you destroy the red bone marrow, you decrease the amount of red blood cell count production. Decreased amount is called anemia. And what about the white blood cell? Will also be decreased or increased? Of course, decreased white blood cell. What is another name for white blood cell? Leukocyte. From the word cyte, which is cell. Leuko means white. So what is the term used when there is a decrease in the white blood cell count? Oh my goodness, very smart students. So what is common? Penia, decreased. Except anemia, it is not anipenia. It's just purely what? Again, what is another for red blood cell? Erythrocyte. What about white blood cell? Leukocyte. What's another name for platelet? There is none. We no longer use the word thrombocyte. So, what is the term used therefore if there is a decrease in your red blood cell or anemia, a decrease in the white blood cell or leukopenia, and a decrease in your platelet or thrombocytopenia? Anybody?
Pancytopenia.
Pancytopenia. Very good. So what does pancytopenia mean? All is decreased. It's always a game of learning begins with words. When you're a visual learner, you read. What comes next? Comprehend or understand. And what's the next step? Retain. So that you can use that to apply. And what do you do during the exam? Recall what you have retained. What happens if you do not retain the information that I've written here? What will you recall during the exam?
Nothing.
Nothing comes from nothing. It is my desire to make you become smart, because a smart student who gets an A in this class will definitely pass the nursing board exam. I'm not saying it's 100% guarantee, but studies have shown, statistical data have shown that anybody who gets an A in this class will most likely, not just most likely, will definitely pass the exam. Because that means not only are they good in anatomy and physiology, but they're also good in what? Pathophysiology. Because if you know what is normal, then you know what is abnormal. Get the example of the platelet. Platelet is for blood clotting. If your platelet count is low in thrombocytopenia, the blood will not clot, you end up with bleeding, patient will die. So what do? Give them platelet concentrate. The problem with aplastic anemia, is there a cure? The only way to save them is to give a what? Bone marrow what? Of course, amazing. Because where is the problem? Which we just discussed. That's how doctors and scientists think. The problem, we know the problem, we solve the problem, hoping that the bone marrow transplant will work. Do you understand? In other words, there is no question in the NCLEX or nursing board exam that you cannot answer. If you just really know your what? Anatomy and physiology. With further readings, there is no doubt you have a problem. You have a problem with that. What else? Oh my God, very favorite something. Pernicious anemia. Okay, what happens here? A decrease in what? B12. So what about B12? Is that necessary for the production of red blood cell by the red bone marrow? Just like your folic acid too, folate. You need that for red blood cell production. So B12 and folic acid. So what happens now? In order for you to absorb your B12 or cyanocobalamin, what's another name for B12? Cyanocobalamin or cobalamin if you want the shortcut. This B12 requires the what? Oh my goodness, I can tell that you're studying. That's the good thing about blended, because you are forced to read and study. I remember when I used to do this for 5 hours lecture, if I asked the student, how many of you read on the chapter for today's quiz? 0. With this kind of program, you're forced. It's not against your will. You can always not study and not pass the class. So intrinsic factor, does anybody remember, based on anatomy, where is this intrinsic factor produced? Where? And where do you find your parietal cells? What is your name in here? Sylvia, where is the parietal cell found? Stomach wall. Aside from the intrinsic factor, what else does the parietal cell produce? What else? What does the stomach produce? What's the name of that acid? Hydrochloric acid. In other words, to be able to absorb your B12 in the walls of the small intestine, the stomach must produce what? Intrinsic factor from what cell? The parietal cell of the stomach wall. The parietal cell of the stomach wall produces intrinsic factor, which is therefore important for the absorption of B12. Because why? Because you need B12 for what? You understand? Is that clear? Okay. So it's important, therefore, as you can clearly see here, that there are many forms of anemia. But the most important thing is that knowing what is it, what is produced, and therefore what happens in these kinds of anemia. Okay? So iron. What about anemia of chronic kidney failure? Well, how do you explain this? Chronic kidney disease or kidney failure. What is it, my dear?
There's no release of erythropoietin.
Where is the erythropoietin produced?
In the kidney.
And what does this particular hormone or substance do?
Helps to start the creation of red blood cells.
So in other words, you're absolutely right. The erythropoietin will stimulate the red bone marrow to produce what? Where did you learn that? Not only in the book, but where? Anatomy and physiology. Do you know that in your chapter there's a chapter that talks about normal? I hope you understand. Every time you read those chapters about the disorders, the chapter before the disorder reviews what? How many of you review the normal anatomy and physiology on the chapters in your book? You should. Even though I just say read chapters 10, 11, 13, 14, 15, oftentimes they review what? What do? They review you the normal anatomy and physiology. Would that help? Definitely, right? And you would complain, oh, I have no more time, Dr. Gamo. You should spend the time. Okay, according to you, in the book it says erythropoietin, but it's something very basic in what? Anatomy and physiology lectures. Erythropoietin is a substance produced by the kidney that will what? Stimulate the red bone marrow to produce more. If the patient's kidney is failing, will it be able to produce erythropoietin? No. Not anymore. And because there is no more erythropoietin, will it be able to stimulate the bone marrow to produce more red blood cells? No. So what will be the result? Anemia. There's a lack of what? Erythropoietin. Now, the idea therefore, class, is this. It's very simple. I gave you the study guide. I normally don't give study guides. The purpose of this study guide is to redirect your attention on things that are important, not because it will come out in the quiz, but the purpose of this is to make you understand that there are a lot of things to cover, but we try to do our best to cover the important ones, the more common ones we see. Not only that, another guide would be what? Anything that is what? Life-threatening. Like bleeding, is that life-threatening? Yes. Anemia, can that eventually lead to a life-threatening condition? Yes? Do you understand, class? Okay? Okay. Now, it's important, therefore, that when we deal with this, we talked about these conditions. Now, the topic on blood flow. Can anybody tell me I will erase that later. What is this formula? Q is what? Blood flow. And what is P?
Pressure.
Pressure what? Pressure gradient or difference. And what about R? Resistance. What is the relationship between flow and resistance? Directly proportional or inverse? Inverse, very good. And what does inverse mean? If I increase this, what happens to blood flow? If I increase resistance to flow, what happens? What will be the effect on blood flow? Okay. In other words, if I have fat deposits here, what do you call the fat deposits here? Plaque. And is that seen in atherosclerosis patients? What happens now? Will the blood flow be decreased? What do you call decreased blood flow? Ischemia. Right? Okay? So, what did the presence of the fat deposit do? Decrease the blood flow. Can that also happen in the coronary arteries from the aorta? The same thing could happen. You have fat deposits there. What happens to the blood flow? Decreased. Now remember, this is coronary artery. What kind of blood does it carry? So when you have decreased blood flow to the myocardium, is that called myocardial ischemia? So the point is this. Whatever happens in the arteries or blood vessels is because of these. You understand? The formula that we have to use and apply. On the other hand, if you decrease the resistance, what happens to the blood flow? Increase blood flow. I'll give you an example. When I give, remember the drug we give under the tongue? It's called nitroglycerin. What does it do to increase blood flow here? Vasodilate. When you vasodilate, like this, so like this, vasodilate, what happens to the lumen, the diameter and the radius? Gets bigger, and therefore what happens now? There will be more blood flow. Will that help relieve the chest pain of the patient? Why? Because when you vasodilate, you decrease the resistance. What happens to the blood flow? You vasodilate, allows the blood to have more flow. Do you understand? Very important. Okay. Now, can anybody tell me the formula R 8NL over pi R to the fourth? What is that formula? R is equal to 8NL pi R to the fourth. Is that in your book? Who said it's there? Raise your hand. I see only 3 hands. What happened to the other hands of these other 30 plus or 40 plus people? Can anybody tell me what is L? Length of what? The blood vessel. What about N?
No, ours radius.
R is the radius of the blood vessel to the fourth power. What is the first letter of radius? Amazing. Simple. What do you think is N? For those 3 people who saw this in the book, what is N? You don't remember? Anybody? The one at the back right there. What's your name? I forgot your name. You have a new haircut, huh? I like it. What does it say?
Hair color.
You are right. From white gray hair to black hair. Thank you, Just for Men. From Walgreens. Yes?
Blood viscosity?
I'm smiling now. Are you giving me the right answer? After looking at the notes that you have notes there? I can tell. So it's called viscosity. N is viscosity. What is R here? The big R. Resistance. That's like the resistance. What is the definition of resistance? What? Forces that will what? The word used in the book. It begins with letter O. It's not obstruction right here. Huh? You're the man, Mr. Ruiz. Opposing. Oppose. In other words, if the blood goes here, what will this do? Oppose the flow of blood in this direction. It will oppose the flow of blood. Do you understand? So resistance is defined as the forces that will oppose the blood flow. The blood flow will be opposed by resistance. Now, what is the meaning of these? Now, in your book, I think they wrote it this way. I would rather write it in the form of a fraction. I like that word. I know it brings back memories of my elementary days. When I studied, I love math and anatomy. Why is it easy to do this as a fraction? Because you see what? What is the relationship between resistance and radius? Inverse. In other words, if you increase the radius, what happens to the resistance? Decrease, just like here. If you give a vasodilator, what happens to the radius? Increase radius, what happens to the resistance? It goes down, and if it goes down, what happens to the flow? Increases blood flow. Guess what? The patient will be happy at you. Nurse, what did you give me? The pain is gone. There's no more chest pain, nurse. Sir, I gave you nitroglycerin. Nitroglycerin is a coronary artery vasodilator, sir. What happened here, sir, is that by giving you a vasodilator, sir, you increase the radius, you decrease the resistance, and when you decrease the resistance, what happens to the blood flow? And that's the reason why, with more blood flowing to your myocardium, there's no more pain. Oh my gosh. Where did you graduate, nurse? From West Coast. I will tell the owner of this hospital only to hire nurses from what hospital? Or from what school? West Coast, the best in the West. The only problem there is stuck, you tell the patient, nitroglycerin is a drug that will vasodilate, as we said, increase the radius, decrease resistance, increase blood flow, relieve the chest pain. But will this drug be only affecting your coronary arteries? No. All the other arteries? Now, what do you think will happen to the blood pressure when you vasodilate? There will be hypotension. And that's the reason why when we give orders for nitroglycerin, either under the tongue or on the chest plate, as a form of a medication skin patch, will I tell my nurses to monitor the vital signs, particularly the blood pressure of the patient? Yep. Of course. For example, if I gave 5 milligrams of this particular drug or nitroglycerin, I can't remember the exact dosage, by giving this drug at 7 in the morning, at exactly 7:30 or 8, the blood pressure dropped from, let's say, 120 to 100 systolic. Are you going to tell me that effect? Yes. Call me Dr. Gamo, it's already 7:05 or 7:10. We gave the drug 15 minutes ago, and apparently there was a significant drop from 115 to 100 systolic. What should I do? What do you think will Dr. Gamo tell the patient? 1, decrease the dose from 5 milligrams to what? 2.5, and let's see what happens. At 2.5 milligrams, which is half the regular dosage, what would be the effect on the patient's blood pressure? The next time the next dose was given, from 120, it remained at 120. Is that a good drug for this patient at that dose? Yes. So we talk to nurses, but we need to make the nurses understand why did it happen. You understand? Okay, now, do you understand what I'm saying? Now, what about viscosity? Viscosity has to do with what? Blood viscosity. Like, for example, when you have what? What is polycythemia vera? A lot of what? Red blood cell in the blood. Will that affect viscosity? Yes. What about hyperglycemia? With too much glucose here. Yes. You know what viscosity means? It becomes what? Thicker. Like, let's say, like, if it's a glass of water, I put 5 tablespoons and 1 teaspoon of sugar and 5 tablespoons, which is thicker? The one with 5 tablespoons. Will that affect the flow of blood in the blood vessels? Yes. Yes, it will. What about the length of the blood vessel? So increased viscosity means what? Increased resistance. Increased resistance, why? What is the relationship between viscosity and resistance? Directly proportional. The moment you increase viscosity, what happens to the resistance? Viscosity goes up, resistance goes up, and when you increase resistance, what happens to the blood flow? It goes up. What is the name of this formula again? POI, Osell's law. Okay, make sure you know that. Because as I have said, your goal here as future nurses is to understand what happens to your patients. Whatever happens to them, can it be explained by this formula that I've written on the whiteboard? And you will never go wrong. R for resistance, 8N, N for viscosity, L for length of the blood vessel. So in other words, this and this directly proportional. What do you mean by length? The longer the blood vessel, there will be more friction against the wall. What happens to the resistance? Higher. So which one is the most important determining factor for regulating resistance? A change in the radius. The most important factor that we can regulate. Example, a patient with high blood pressure, what do I give? A vasodilator or vasoconstrictor? Of course. Can you imagine if you give a vasoconstrictor, the blood pressure goes up, the patient will die, and that is how you fail the nursing board exam? Whenever I tell students, whatever you do and whatever you answer in the nursing questions, every time you come up with the wrong answer, there's a potentially dead patient. Which one will lower the blood pressure? Vasodilator. Which one will increase more the blood pressure? Vasoconstrictor. Have you ever noticed when we play with the garden hose, And if the water pressure is low, what do we do at the tip of the garden hose? We put our finger to decrease what? The radius. And when you decrease the radius of the water hose, what happens to the pressure of water? We sick. But if you do not put your finger there, the tip, what happens? But if you put your finger there, the water pressure will what? Pssk. How many of you water your gardens? Me? You do the same thing? So every time I do my experiment. Is it really true that if you decrease the radius, the pressure goes up? But if you decrease the radius, the pressure goes down. So therefore, are we going to give a vasodilator to lower the blood pressure of patients with high blood pressure? Yes. Are we going to give a vasoconstrictor or a vasodilator? Because if you give a vasoconstrictor, the patient will rest in 6 feet under the permanent resident at, and you will pass or fail the nursing board exam. In other words, there is no question that you cannot answer in the nursing board exam. If you know this formula and you know how to apply them in the real world. Do you understand? Now, what is thrombus? Thrombus. What kind of clot is it? Huh?
Stationary.
Stationary clot. Okay. What about an embolus? Traveling clot. Now, do you remember the difference in arteries and veins? Both of them have the same layers, right? Tunica intima, made of the endothelium. What is next? Tunica media, made up of what? Smooth muscles. What about the outermost? Tunica adventitia. What does tunica mean? Layers, right? Tunica intima, made of endothelium, which is smooth. Tunica media, made of what? And what's the outermost? Adventitia or externa. So what is the significance of the smooth muscles here? When the smooth muscles contract and go into muscle spasm or vasospasm, you have vaso what? Constriction. And if they contract, you have vasoconstriction. What happens to the blood flow? Decreased blood flow, but what happens to the blood pressure? Increased blood pressure. On the other hand, if you give a drug like nitroglycerin, what do you think will it do to the smooth muscles? Relax first. The muscles do not dilate, they only what? Contract or relax. If the muscles here in the smooth muscle wall relaxes, what happens? Vasodilate. And when you vasodilate, you increase what? The radius, you decrease the resistance, and when you decrease the resistance, what happens to the blood flow? Blood flow will increase if it vasodilates. Why did it vasodilate? The smooth muscles what? Relax. That's good. Could that be the mechanism of action of these drugs, like nitroglycerin? 15% of the questions in the nursing board exam has to do with pharmacology. Nitroglycerin, is that a drug? Because it causes vasodilation. So what do you think would it be its effect? Smooth muscles could probably what? Relax, vasodilate, increase the radius, decrease resistance, increase blood flow. Does that make sense? And at the same time, it will lower your what? That's the reason why we have to monitor, because it does not only affect the coronary arteries, but including what? The arteries of the lower and the upper limbs. Do you understand, class? Now, going back to thrombus and embolus. A thrombus is a stationary what? Clot. For example, here. Can you form a thrombus here? Yes. Together with the plaque or fat deposit in the coronary arteries. And what happens if there is a blood clot and fat deposit here? From myocardial ischemia or decreased blood flow with chest pain, what happens now? What happens to the muscles here? They die. It's called myocardial infarct. What caused the death of the muscle tissues there? The blood clot and the fat deposits. Now, is it possible to form a blood clot here in the left ventricle? Yes? How does that happen? Simple. Remember, when the heart is supposed to pump blood, there's continuous flow. What happens if you have an arrhythmia? R means without rhythm. So during that time, it did not pump blood. Will it form a clot? Because it's stationary. It did not move. The clot will form because of a fibrillation. Guess what happens to the clot? Like atrial fibrillation, or ventricular fibrillation, can the clot travel to the heart brain? Yes, it could travel to the brain. From the aorta, the common carotid, then internal carotid, then cerebral. Is that cardioembolic stroke? Is that a traveling clot? Why traveling? It traveled from the left ventricle to where? To the brain. Can that happen on the right side of the heart? No. Well, you can form a clot here, but can it travel to the brain? No, because why? It will stop in the lung. Why? Because what do you have in the lung? The very small blood vessels called pulmonary capillaries. If there is a clot on the right side of the heart, you end up with pulmonary embolism. What about a clot in the inferior vena cava's leg veins? And what did I say? Leg veins? Can the leg veins end up with the inferior vena cava? What is the term called when there is inflammation of the leg veins and the clot is attached to the wall of the leg vein? Thrombo. Number 20 in the study guide. Thrombophlebitis. Thrombo means stationary clot. Phlebo means vein, like phlebotomy, get blood from the veins. And what is itis? Will you be able to see this in your nursing home patients?
Yes.
Patient come to you and say, nurse, I have pain in my leg. How do you know it's painful? Are you going to examine the leg?
Yes.
Are you going to determine, sir, when did it start? Maybe 2 days now. Why did you not tell me? It's okay. I thought it would be gone. You examine the leg, and indeed, how do you know it's inflamed? What is rubor? Redness. You examine, you can see the redness. Is that sign or symptom? Sign. What about the pain? Symptom. What about calor? What is calor? Warm, caliente. Are you going to palpate with your fingers? If it's red, it's warm, and there is pain. And what is tumor? T-U-M-O-R, tumor. An increase in the size. Are those the cardinal signs of inflammation?
Yes.
Is that thrombophlebitis? Now, what are we going to do? Are we going to move that leg? Yes or no?
No.
No! What do you think happens if you move that leg? The clot that was attached to the wall of the vein will now be dislodged. It becomes a what? Traveling clot called an embolus. Can that embolus in the leg vein, inferior vena cava, can that go to the right side of the heart?
Yes.
Will it stop in the vena cava? Big blood vessel. Will it stop in the right atrium? Big atrium. What about the right ventricle? What about the pulmonary capillaries?
Yes.
Why? They smile. Only one red blood cell can go through, remember? Which I erased. So the blood gut will get stuck where? In the lung? Is that pulmonary embolism too?
Yes.
Can you form a blood clot in the right side of the heart due to an arrhythmia like atrial fib on the right side? Yes, but it ends up with what? Pulmonary embolism. You understand? So if the clot is on the leg vein or the right atrium or right ventricle due to an arrhythmia here, the clot will have no choice but to stop where? The lung, because of the presence of the pulmonary capillaries. On the other hand, if the clot forms in the left ventricle, can it go to the brain, causing a cardioembolic stroke?
Yes.
Who is assigned to strokes? Very good. Are you the only one in your group? You just don't want to raise their hand because they're afraid to be asked. Can this clot travel to the kidney?
Yes.
Of course. It's like your 405 North and 405 South freeways. Sky's the limit for the clot. If only the clot could speak, OMG, Dr. G, thank God. I love all these freeways that you have provided me. I can now travel to the brain, I can go to the kidney and cause havoc to these organs. I'm the blood clot that has now become a traveling clot called embolus. Can that traveling clot go to the kidney? Yo! Can that blood clot go to the liver? Yes. Can it go to everywhere and anywhere? Yes. Are we going to treat, therefore, the atrial fibrillation with regular medication and dosage? Are we going to put that patient in a Holter monitor so that we will know that he does not have any atrial fibrillation? Are we going to give that drug with medication to control the arrhythmia?
Yes.
How do you prevent the development of a clot in the leg veins? For people who are nursing home patients, it's because of what? Lack of exercise and lack of mobilization. So what do? Huh?
Physical therapy.
Let them exercise. Sir, ma'am, let's stand. Let's dance, the boogie. Why? The reason why they form the clot in the leg vein because there is lack of what? Exercise. Immobilization. How do you prevent the formation of blood clot and thrombophlebitis? Exercise. But the moment they have the thrombophlebitis, no more what?
Exercise.
Movement, no more range of motion. You have to keep it immobilized because if you do so, that clot becomes an embolus. From thrombus to embolus, the patient can, because of pulmonary what? How do you know? Very simple. You're the nurse. You have a clot in the leg, and you began to exercise because you were not paying attention today. You exercise the leg, and after exercising the leg for maybe 10 minutes, within 5 minutes, the patient suddenly complains about, I can't breathe. I can't breathe. I have chest pain. I have chest pain. Could that be pulmonary embolism?
Yes.
Who caused that? You. Because you were not paying attention today. And that is the best way to lose a license or not pass the board exam. Because you are what? Competent or incompetent? So we are here to develop you to become the best competent critical thinking nurses so that you can save what? And not kill people. And what is it called when you kill a patient if you're a nurse? It's called NID. And what is NID again? Nurse-induced death. No, I'm just joking. There is no such thing. NID stands for what? Nurse-induced death. What is nurse-induced death? The patient died because of the incompetence of the nurse. But I'm fully assured that you are smart and competent because you come from what grade school? The best in the West. Okay? If you come from a different school, maybe. But I will not mention any more the names, okay? Do you understand? Now, okay, so you see the difference in thrombus and now believe me, I did review nurses for 8 years before I came up with a nursing review center, right? In the new types of questions for the LVN exam and RN exam, they show you a picture of the heart and the 4 chambers, and they will ask you, you have a picture there, where do you think is a likely source of a cardioembolic stroke? Is it right atrium, right ventricle, or left ventricle? Anything on the left, preferably left ventricle because that's the main pump. Go to the brain, you end up with a cardioembolic stroke. Answer easy because you know your anatomy. You will never reach the brain if it's on the right side of the heart because this goes to the lung. How did you know that? Anatomy and physiology again. Do you understand? Okay? Is that clear? Now, what is thromboangiitis obliterans? This is a smoker's disease. Patients who are young and males, they smoke. What happens? They develop Berger's disease. It's called thromboangiitis obliterans. And they develop what? Necrosis and gangrene. What do you do with the foot? So how many of you are males here? Okay. Then how many of you smoke and male? Okay, go ahead. I will take pictures of your foot and your fingers that start to develop necrosis, and we will document it. It's called thromboangiitis obliterans or Berger's disease. And what is an aneurysm, my dear? What happens to the artery? There is a ballooning of the wall, like in the brain, right? Like this, balloon. Usually due to 2 things. What's the most common? Well, congenital. You were born with an aneurysm. The second one is what? Prolonged hypertension that is not controlled. If you remember Bruno Mars, the mother, the Filipina American woman, at the age of 54, I think, 54, 55, died of what? A ruptured aneurysm of the brain. Now, I forgot the name of the comedian. Three's Company.
Oh, yeah.
John Ritter, yes, he also had an aneurysm here in the carotid artery. It also burst. Sad. Okay? An aneurysm. It's ballooning of the wall. The wall gets weaker every time your blood pressure goes up. And what happens when you do this? When you do a straining procedure or Valsalva maneuver, will that affect your blood pressure?
Yes.
If that blood pressure gets bigger and bigger, and it gets bigger, just like a balloon, it will what? Ruptured artery, aneurysm. Can you die? Because you're bleeding inside the brain.
Yeah.
You have to do an emergency craniotomy to decrease the intracranial pressure. Sad to say. I miss the guy, John Ritter. Of course. Sad to say. Bruno Mars lost his mom. Very young woman. Her name is Bernadette. I have nothing else to do. I watched YouTube and oh, yeah, Bruno Mars. Aneurysm, relevant. It can happen to anyone. It could happen to me. Right? Okay? Okay, so that's an aneurysm. Hypertension, hypertensive bleed due to an aneurysm. So is there a treatment for this? There are many ways to do this. You have a coiling and you can read on this, right? What is the difference with thrombophlebitis and deep vein thrombosis? What is affected in deep vein thrombosis? Deep veins or superficial veins? Oh my gosh. What about thrombophlebitis? Superficial veins or deep veins? It could be both. But most likely what? Superficial. That's the reason why you see the redness. Palpate the warmth. But both of them involve the leg veins. One is deep, one is what? Superficial. But it could actually affect both. The most typical story is this. Like me, August last year I went home to Philippines to have my 40th high school reunion. How long will I stay in the plane? 12 to 15 hours. What happens if I sit in that plane for 15 hours straight without moving at all? Can I form a blood clot in my leg veins?
Yes.
I could. And I'm trying to get my baggage and it will just collapse with chest pain, and guess what? What happens to the clot there? Can it travel to the lungs?
Yes.
Can that lead to the development of pulmonary embolism?
Yes.
Can Dr. Gamo die?
Yes.
And because I'm still here, I did not die. I did not have any chest pain and shortness of breath or SOB. But did I anticipate that? I did. So what did I do to prevent that from happening? What did I do? I kept on walking inside the plane. You remember, my wife is sleeping. Honey, just go to sleep. I'll just get to know people around the plane. She's laughing at me. You're from China, right? We passed by, I think, China, in Taipei. I couldn't speak the language, and they think I'm Chinese, so I just said, I could say. Even the flight stewardess, so. Restroom? Restroom. So that's what makes use to go around. Why do I need to go around? I can move my leg, because I'm fully aware that I can develop what? DVT. So now you know, educate the people around you, your loved ones, your mom, your dad, your uncles, aunts. You're going home wherever you want to go to Europe, exercise your leg while you're inside the plane, right? Or else you end up with what? Pulmonary embolism there due to DVT. Now how do we treat blood clot formation like this? Like if you have a clot in the brain, or a thrombus in the brain called a thrombotic infarct. Because the moment you have a blood clot there, the blood will not flow in the cerebral arteries. What kind of the drug do we give?
Anticoagulants?
Okay, what's an anticoagulant, my dear? Heparin. What else? Warfarin or Coumadin. What do anticoagulant drugs do? Prevent what? Further clot formation. Can they dissolve the clot? The answer is no. They can only prevent what? Further clot formation is called anticoagulant. Some people use the word blood thinner. I don't want to use the blood thinner. It's like pain thinner. I'm just joking. What about the thrombolytic drug? Will that dissolve the clot? What is thrombus? Clot. What is lytic? Breakdown of the clot. So any drug that ends with inase, streptokinase, is that a thrombolytic drug? Gamokinase. Yes, it is. One of these days, the moment I retire from teaching, I'll put up my own chemical company in pharmaceutical. I get it from China and wherever I can, from India. I repackage them in a different box. Gamma-kinase. Sell it cheap. I'm a businessman. But when you take the nursing exam and you see the word gamma-kinase, bang! Thrombolytic drug. Remember Dr. Gamo, okay? Now my point is this. When I was doing a nursing review for a lot of years, a lot of students complained to me and said, Dr. Gamo, I'm overwhelmed with the number of, there are thousands and thousands of medications, right? It's called smart studying. Do I expect you to memorize all the drugs in the world? Unless you're an MD, of course. An MD has to know. The nurse, maybe not. But you have to be smart. If the drug ends with kinase, abokinase, streptokinase, gamma-kinase, it could be what? A thrombolytic drug. Now, why do we give thrombolytic drugs? Do we give thrombolytic drugs to bleeding inside the brain? No, we only give it for a clot because it will dissolve the clot. That's the reason why we have to do the CT scan or MRI scan first of the brain to determine whether it's a thrombus or it's a hypertensive bleeding. Do you understand? Is that clear? Yes. Now, so there is a thrombolytic drug, dissolve the clot, streptokinase, abokinase, urokinase. On the other hand, drugs like heparin, warfarin, they're only what? Anticoagulant, they prevent further clot formation. What about aspirin? Aspirin is also known as acetyl salicylic acid. Get to know this drug. Is it a common drug?
Yes.
What is the main action of this drug? Mechanism of action. Is it anticoagulant?
Pain.
Is it a thrombolytic drug? What does it do? Well, it's an anti-inflammatory drug because that's why it's so non-steroidal, steroidal. But what exactly does it do? It prevents the platelets from what? What's your name again? Vivian? Explain to us what is aggregate. It's a big word. There you go, to clump together. Why do they need to clump together, Vivian? Tell me. There has to be a reason. I'm always out of frame. Every time I go like this, I can only see my neck. Yes, Vivian? So why do they need to aggregate, Vivian? The answer is correct. I can see you're reading your notes on your book. And maybe you might pass the nursing board exam only for this question alone. Joke only. Yes, Vivian?
Why they club together?
Yes. Why? What for? So they can hold hands and go to Disneyland? You don't know? The answer is incomplete. Remember when there is bleeding? Could there be a break in the wall of the blood vessel?
Yes.
There's a break in the wall. Let's say break. So what happens now? The blood can what? Go out, right? There's a break. What do you think the platelets do? They clump together, they aggregate together, and they form what? A plug. Who said plug? Yo, yeah. PLUG. Like if your pipe is leaking, what do you put? A rubber hose or something to stop the blood or the water from coming out, right? It's an anti-platelet aggregate. They will not gather together to form a plug. But they're not anticoagulants, please. What's another name for platelet? For aspirin? Acetyl salicylic. Now you might be asking, Dr. Gam, do I need to know all these things? I'll tell you why. I just want you all to pass the nursing board exam. You're familiar with the word aspirin, right? Are you familiar with ASA? No. So what happens during the board exam? You have a choice of drug. The following drugs are antiplatelet aggregants: heparin, warfarin, streptokinase, gamma-kinase, and ASA is the last one. What are the chances if you will choose ASA? We don't even know what the hell is that. ASA is nothing else but what? Aspirin. You understand? Is that clear? Okay. Now, let's deal with hypersensitivity. There were what? Type 1, type 2, type 3, and? Okay, again, the use of a concept map. Okay. What would I put under hypersensitivity? Type 1. Type 2. In fact, there is a table in your book, right? That summarizes all these things. Okay, what are the what examples of type 1?
Anaphylactic shock.
Anaphylaxis, what else?
B-by.
What? B. Okay, B bite. Okay, what else? What about asthma? Anaphylaxis or allergy, right? What else?
Hives.
Hmm?
Hives.
Allergic what? Rhinitis. Rhinitis. You know when you sneeze in the morning because of the pollen, right? Asthma, anaphylaxis, allergy, and of course, allergic rhinitis, a bee bite. Now, what is the mediator? What cell is involved here, or what antibody? And what produces your immunoglobulins? Your B cells, right? So these are all B cells. B cells. What about this one?
T cells.
Type 1, type 2, 3. What was it? 4. T cells. 4. 1, 2, 3, 4. T4 is T cell, B cell, B cell, B cell. Why? What are the antibodies involved here? IgM, right? IgM, GIgM, right? Okay. Or MG or GM. Immunoglobulin what? M, immunoglobulin G. IgE associated with allergy, remember? Now, in the case of allergic rhinitis and all these cases here, what is the neuroeffector cell involved aside from the Ig antibodies? Mast cells. And what do mast cells produce? Histamine. And what does histamine do to the blood vessels? Oh my gosh! Is that the reason when they vasodilate, will there be increased what? Blood flow. That's why you develop what? Redness. Does it make sense? So what do you think Dr. Gamo will prescribe the patient with an allergy? Antihistaminic drug. Isn't that amazing? There's no answer that cannot be given in any question you ask in the nursing board exam. The problem is histamine released by the mast cells, which degranulates with exposure to the allergen, which is the antigen. You develop anti-IgE, and you end up with vasodilation, with redness, itchiness, pruritus. Now, what can kill a patient with asthma? Very good. Bronchospasm and bronchoconstriction. They end up with what? And what is that? Wheezing. That is narrowing of the airways. Can the patient die? Yes, they can. So what do you think we give the patient? Broncho? I love this class. Or else the patient will die. Are those puffers bronchodilators? Yes, they are. What about type 2? What's another name for type 2? Tissue specific. What else? Cytotoxic. What else? Cytolytic. Okay? So this is the effect would be 15 to 30 minutes, very fast, right? Immediate. Same thing here. So what are examples here? Transfusion reaction, very good. Why? If you give the wrong blood type, like me, I am blood type B. What do I have in my red blood cell? Red blood cell is B. What do you have in my plasma? Anti what? Anti-A what? Antibodies. So somebody gives blood to me. I'm lying down in the bed. You give blood to me. You give blood, and this is Dr. Gamo, very sexy here. You give blood, and this is type A. What does he have in the red blood cell? A. Now what do I have in my blood? Anti-A antibodies. Where is the antibody found? In the patient. The one receiving the blood, the donor, is not going to be affected. Who will be affected? The recipient of the blood from this guy. Am I supposed to give blood type A from somebody? No. Why? The moment you give that blood type to me, what will my antibodies do? Attack the red blood cell. The red blood cell will what? Burst. It's called hemolysis. Do you understand? But who suffers? Me. I develop kidney failure. I die. Do you understand? Is that clear? What else? Aside from the transfusion reactions? Graft rejection. Example. I get a kidney for a kidney transplant from somebody I do not know. Well, will it be rejected? Of course, because why? It's a foreign body. If I get a kidney from my identical twin, what are the chances of being accepted? Maybe higher? Or probably a relative, but do they do compatible studies first? Compatibility? Yes, they do. It's a waste of energy and money. It will be rejected because why? Again, you have antibodies attacking the organ being donated to you. What else? What? Myasthenia gravis. What does myasthenia mean? Myo means what? Muscle. What is asthenia? Weakness. So the antibodies will attack what? The receptors for what? Acetylcholine, which is necessary for what? Muscle contraction. Remember? If you review the anatomy and physiology of muscles, what will make them contract? Acetylcholine. Receptors are attacked. So therefore, there is no acetylcholine that will make the muscles contract. Muscle weakness will ensue. And what's the most important muscle in the body in myasthenia gravis? Believe me, this will all come out in the nursing board exam. So is it necessary to give the medications on time?
Yes.
Because if you don't, the patient will stop and the patient will die. Understand? Yes, ma'am.
So what's for the treatment? Sometimes thyroid or things they take.
In patients with myasthenia gravis, we give drugs called anticholinesterase.
But what kind of surgery can be performed? Because there is surgery for that, no?
Myasthenia gravis is medications. Unless they think of the thymus gland as possible, yes, but most likely we have to give anticholinesterase drugs like tensilon. You will learn this later on. The goal is that to prevent the enzyme that breaks down the acetylcholine to make the levels of acetylcholine remain high. Because without acetylcholine, the muscles do not contract, particularly the muscle called the diaphragm. You stop breathing, you die. Okay? What else aside from myasthenia gravis? Hmm?
RH.
Okay, what about RH?
RH negative mother.
So hemolytic disease of the newborn.
Yeah.
Okay, what about that? What's another name for hemolytic disease of the newborn? Erythroblastosis what? Okay, what happens here? Very simple. If you were my student in anatomy, I discuss it with you. What's the problem in this case in hemolytic disease of the newborn, also known as erythroblastosis fetalis? The mother is what? Mother is? Okay, let's erase this. Okay, the mother is Rh negative. Father is Rh what? Positive. Mother, father, of course they have sex. Mother gets pregnant. First baby is what? Rh positive. Negative mother, positive fetus or baby. Now, prior to the pregnancy, what do the mother have antibodies? No antibodies to Rh. Rh stands for what? Rhesus monkey. How many of you are Rh positive here? I am. So I'm related to the monkey. No, I'm just joking. So the rhesus monkey has the same Rh positive what? So like remember the red blood cell has B, ABO antigens. What do we have on the surface of the red blood cell? Rh antigen. So I am blood B positive. What does B positive mean? I am type B with B antigen on the surface of my red blood cell. My mom is B, my dad is B. How can I not be B? Unless I was adopted, okay. Which I'm not. I'm pretty sure because I was there when the sperm met the egg inside the fallopian tube. I'm joking, of course. If I am B positive, the positive means RH what? Positive. So I have to be careful. Whoever I have sex with, before having sex with the woman, I would ask, are you RH negative lady or not? I'm not joking. Because if that person is negative, there's a problem. But my wife is positive, we can have as many kids as we want. But she wants only 3. What can I do? Okay. Mother is negative, father is positive, baby is positive. Mother has no antibodies. But what happens during the first pregnancy? During the first pregnancy, what happens? During the 9th month of pregnancy, on the EDC or expected date of confinement, the mother goes into labor. Oh my God, so much pain. No more babies. The baby comes out. What comes after the baby? The placenta. When the placenta separates, is there a possibility of mixing of the mother's blood and the baby's blood?
Yes.
But the baby is safe. Why? Because the baby is out. Baby out first, placenta second. But the baby is safe. Who suffers now? Because this is what happens. When the baby's blood and the mother's blood mixes here, what happens now? The mother is sensitized. The mother now develops what? Antibodies against what? RH. So now, guess what? Second pregnancy. Same father, the same mother. Again, RH positive. What happens during labor and pregnancy? The antibodies here will attack what? The red blood cell of the second baby during labor and delivery. That's why it's called hemolytic disease of the newborn, because upon birth, the newborn, hemolysis means what? Rupture of the red blood cell. Who destroyed the red blood cell? The antibodies of the mother. Isn't that sad? The mother killing her own baby. It's not her fault though. It's not the fault of the father. Nobody's fault. Knowledge is important. Educate your patients. Okay? So what can we give this mother? Okay, from the word ro and then what? Gam. What does gam mean? Gamo. Why are you laughing? It's gamoglobulin. No, gamma, not gamo. It's called gamopathy. Okay. Rho from the word RH, gam, means gamma globulin, is what? It's a man-made what? Antibodies, which is basically what? Passive immunization. Passive immunization means injecting the mother with what? Or anybody with what? Antibodies. Why do we want to inject the mother here on the first pregnancy? By injecting them on the 7th month of pregnancy and during labor on the first pregnancy, you are trying to prevent the mother from what? Prevent the mother from developing her own antibodies. What will kill the mother? Or the baby, the second baby? The antibodies produced by the mother. When we give the mother the antibodies called Rogam, created by man, that will prevent her from developing her antibodies that will kill or cause the hemolysis of the red blood cell of the second baby. Are we going to give it in the second pregnancy? Yes. What about the third pregnancy? Yes. Do you understand? Is that clear? Okay. Now I'm going to be talking. What time is it now there?
7:30.
Okay. Do you understand?
Yes.
Give Rogam, save the life of the patient. What's the name for hemolytic disease of the newborn? Erythroblastosis fetalis. Now, when the patient has hemolysis, what do we use to monitor the patient's hemolytic condition? What do we use? What? What do we use to monitor the patient's condition? Anyone? When the red blood cell will burst, guess what happens? Huh? What is released? What happens? Bilirubin. Very good. So bilirubin will be released into the blood. What happens to the blood levels of bilirubin? It goes up. That's the reason why they develop jaundice. What is the color of bilirubin? It's a yellow pigment. In other words, what happens is that these patients develop hyperbilirubinemia jaundice. Can you develop jaundice in hemolytic disease of the newborn? Yes, you do. You understand? Okay. And guess what? Can that baby die?
Yes.
Yes? Very sad. And you can expect the bilirubin to go to the brain, cannot damage the brain. Damage of the brain is called what? Kernicterus. Remember the word icteric sclerae? Jaundice is a word, means yellowing of what? The skin. Only for the skin. Jaundice should not be used for the eye. In the case of the eye, when it turns yellow, it's called what? Icteric sclerae. What is sclerae? The white portion of your eye. What caused this to happen? High levels of what? So would you expect that to be seen in hemolytic diseases or hemolysis? Yes, you do. Okay. Now, what about in type 3? What is the examples of type 3? Anybody?
Antigen, antibody.
Autoimmune immune complex, like what? Post-strep what? Glomerulonephritis. What does that mean? A patient has sore throat. What's the cause of the infection? Streptococcus and tonsillitis. Now what happens? You develop antibodies against the antigen, but unfortunately this will not attack only what? The throat, but also attacks what? The kidney. The kidney becomes inflamed. That's why it's called post-strep glomerulonephritis. And when the glomerulus is inflamed in the kidney, will you have red blood cell in your urine? Yes, you will. Is that hematuria? So when a patient comes to you and say, you know what, nurse? 2 weeks ago I had a sore throat, I had tonsillitis. 1 week later I noticed my urine, it turned red. Is that post-streptococcal glomerulonephritis? Is that type 3? Yes. Now what else? What? Lupus erythematosus is the worst kind of autoimmune disease. My mom died of this when she was 42. Why? Because you develop antibodies to all your organs, to all your cells, brain cells, heart cells, lupus nephritis, lupus carditis, lupus pneumonitis, lupus cerebritis. Is there a cure?
No.
That's why my mom died at a very young age, 42. Very young. Now what about type 4? What's another word for this? So immune complex, delayed what? Hypersensitivity. It takes like days and weeks for it to result. Like, I think 48 hours, like, what was the example given here?
48 to 72 hours.
48 hours like you what? Your, okay, what's the name of the test? It's not tuberculin, but it is called what? Okay, mantle what? Skin test. What do you inject to the patient? PPD. What is PPD? Purified. What is PPD again? Protein derivative. What exactly is a purified protein derivative? It's part of the tuberculous bacteria. So when you are injected with that, now what cells are involved here? T cells, right? Delayed 48 hours. To let them come back after how many hours? So if I do it on Monday at 6 in the morning, let them come back what? Wednesday, 6 in the morning. I will read. How do I know it's positive? Induration means it's elevated, it's hard, and it's red. And not only that, it should be 10 millimeter or more. I need to have a tape measure because your body reacted to the what? What does it mean? Does it mean that you have active TB or you have just been exposed? You have been exposed, but your immune system is good. You develop what? Immune resistance. So what do you check? How do you check if it's positive? Chest X-ray is next. What is better, chest X-ray or sputum culture? Well, sputum culture. Why? Because when you scoff out the sputum, are you going to grow the organism called Mycobacterium tuberculosis in that culture medium?
Yes.
So which is better, sputum CS or X-ray? Sputum CS still. There's a special type of culture medium. Now I know there's now a special test like I think gold interferon or something. My son wanted to work at UC San Diego and it was done on his blood specimen, which is amazing. It was never present when I was a medical student 30 years ago. Okay? So make sure you know all this. Now what's next? Now leukemias. Which one is seen with the Philadelphia chromosome? CML. What about in children? ALL. So children is AL, the rest are adults. So basically the reason why they die is because of what? People will, oh, my Tigran is studying, huh? Why do they get infection, Tigran? Tell me.
They don't have enough white blood cells.
Now remember, leukemia has high white blood cell. Why do they die of infection? Because what kind of white blood cells do they have? Abnormal or immature or lymphoblast. See? Remember, there were two types of white blood cells. Remember the myeloid and the lymphoid. The lymphoid was what? Lymphocyte. T lymphocyte, B lymphocyte, and NK cells. What about the myeloid? Neutrophils, red blood cells, even the platelets, right? You understand? Is that clear? And what about multiple myeloma? Why is it important for us? It affects the bones. The bones break. Now, what is the most important test that we use for multiple myeloma patients? Which means what? Okay, Jones. Jones-Benz is the opposite. Jones-Benz or Benz-Jones? Spell for us Benz-Jones, Mr. Tigran.
B-E-N-S.
P-N-C-E. Not Mercedes-Benz, huh? Benz-Jones proteins, right? Will that be found in the urine?
Yeah.
Will that be found in the blood? Yes. So whenever it's positive, there could be multiple myeloma, a lot of bone pain and pain, okay? Okay, that's it. You can have a break. 5 minutes, put everything in front, please. And that's the end of our teach back for today.